Along with standing firm in his faith conviction, Senator McDonnell also refused to vote in favor of changing the way Nebraska counts its electoral votes. His decision could have a major impact on the outcome of the presidential election. EWTN News in Depth will bring you that part of the story next week. On Tuesday, a coalition of doctors and medical organizations launched the Women's Healthcare Declaration, calling for accurate information about abortion to be given to patients. They are urging agencies, medical boards and leaders, associations, and hospitals to accurately communicate state laws about abortion and pregnancy complications.
There are those who are spreading deceptive and inaccurate information about state-level laws that prohibit intentionally causing the death of an unborn child. They claim that without a highly permissive approach to induced elective abortion, it is impossible for physicians to treat women facing serious or even life-threatening pregnancy complications. Nothing could be further from the truth.
The declaration calls on state and federal policymakers to enact changes to restore the medical standard of care for women. Joining us now is Dr. Robin Pierucci, who is a wife, mother, clinical neonatologist, and medical director of a 50-bed NICU. She is one of the signers of the declaration. Dr. Pierucci, thank you so much for being with us today. This declaration calls for all healthcare-related entities, from government agencies to hospitals and doctors, to provide accurate information about abortion and state pro-life laws. Why do you think there's been a lack of proper clarity about state laws?
Well, I think, first of all, thank you for having me. Boy, when it's such an emotional issue, inaccuracies are easy to have out there, but we can't let them stand. Women deserve to be treated well. Excellent medical care that is compassionate is baseline of what everyone deserves, women and their babies. And this information just needs to be out there.
The declaration calls out the widespread use of the abortion pill and the relaxed rules by the Food and Drug Administration to take the dangerous drug. What are the consequences you've seen from these relaxed regulations?
Well, women have suffered everything from death to near-death experiences. It also sets them up for problems with future pregnancies if something like RH exposure is not caught. This is not like taking Tylenol. This is serious medicine. And with the deregulation that the FDA enacted, women are literally put in danger. And they don't do this for other drugs.
Dr. Pierucci, you've dedicated your whole life to the medical profession. What impact do you hope this declaration will have?
I'm really hoping this is an olive branch. There's so much that we agree on. No one that I know of shows up to intentionally harm anyone. And yet that's the result of information that's inaccurate. So we really want everyone to know that the FDA needs to put back the normal regulations that it would do for every other drug, and that the laws never get in the way of physicians intervening when there's any patient that needs help. If a woman has suffered from a miscarriage or an abortion, there's nothing out there that says we should not intervene. In fact, we must. We swore an oath to do no harm. We intend to honor it and invite everyone else to do so.
That's incredible. Dr. Pierucci, thank you so much for being with us.
Thanks for having me.